Hello and welcome from Frankfurt, where I'm standing right now in the so-called PwC Experience Center, together with Thomas Solbach, partner of Strategy and the consulting firm of PwC. And today we conducted a workshop about the future of health with a key question: how can companies reinvent their business models and make it tangible, make it ready for the future? Thomas, you're the host of this event. So what is the reason that we are here? So what is behind this future of health and business model reinvention paradigm?
Absolutely, and thanks for having you here, of course, Julian. First of all, it has to be said that our value is in motion wherever we're looking, right? So we have positive effects in the world as well as negative effects. And on the positive side, when we think healthcare, our understanding of diseases as well as health was never better. We have new technologies to measure individuals, and we also have interconnectivity of data sets. And that brings also how we care into a different sphere. And if we think about what is the future of healthcare like, then we do believe that it will be way more human-centric, people-centric and not patient-centric only. And this is a huge difference. It will hence need to be preventative, if not enhancing, because nobody of us wants to get sick in the first place. And if we want to go towards prevention, even more important than in healthcare, so in sick care, it will need to be much more personalized. And that means prevention not only starts and ends with a disease, but more health coaching. So a doctor will still be the one kind of transmitting that, but he or she needs to be rather a health coach that also understands healthy nutrition, healthy sporting and the alike. And lastly, and that brings us also into the sphere of an ecosystem, healthcare needs to happen in the here and now, in the 24/7 of us, and not only at a doctor's place. And this is where different players come together and need to form ecosystems.
That is a great segue. That's mostly the reason also why you invited me today, also to give a quick impulse. The role of ecosystems, but before we go to that, I really like very much this notion of human centricity, which is also one of the theories, one of the topics actually I'm behind, and also of the topics of domain we care. That is the domain, how we call it, not just it's the healthcare sector, it's more that we think about a broader, let's say, market focus. And then, of course, we come to ecosystems. And of course, my question is then, what's the role of ecosystem there? You started elaborating on that, but maybe you can dig deeper a little bit. Why are ecosystems so important also for the future of health and for reinvention of business models of companies in this sector?
So we're seeing a huge shift of society to wanting actually taking care of their personal health actively. And probably that's also to do with COVID and also omnipresence of healthcare, beauty, wellness on social media. But it's a fact that people want to take more care. And health is for this time, sick care is for this time more limited to seeing a doctor in a hospital or in a private practice. And that is what, I don't know, 10, 12, 15 hours annually per person, right? Even sometimes less, and it's good so. But healthcare needs to happen in that 24/7. And the 24/7, we're using cars, we are wearing clothing, we are eating food. And this is important to keep ourselves healthy, because we know by now the air we breathe, the water we drink, the sport we do or we don't do, this is kind of having a big impact on our health, and we know that.
Absolutely.
And therefore, we need to, from different angles, take care of healthcare of people. And in a car, we generate so many data that can be predictive of how somebody is doing, and if there is an early onset of cognitive decline or reaction time being in sync with the onset of neurodegenerative diseases and the like. Smart wearables. I mean, you're wearing a watch, I'm wearing a ring, right? So you can keep track of yourself. Data is generated there. They are sitting on different spots for now, but in order to really take advantage, the full potential of it, we need to bring different data sets, different solutions that exist into an ecosystem to really cater for us, to make it as easy as possible to take care of our healthcare.
That's a great answer also from this notion of what drives actually our life and how can we improve our life with all these measures, and also ecosystem as actually the other side of the coin as a delivery of that. Now, last question for today, the role of the companies and the business models in the future. Which kind of business models do you see out there with a look of the future of healthcare?
I mean, if we will see eventually that future of healthcare that will be more preventative than traditional brick and mortar hospitals that exist today. They will need to reconsider their business model of the future, and probably they also need to extend their current service towards a preventative clinic. They will need to find ways on how they, going forward, ensure their patients' people to keeping them healthy and ensure for prevention. Different mechanics that need to be applied. And pharma companies, if they really want to tailor their medicines to the very patient, and this is the absolute clear trend, they will also need to better understand the human being, so entering the 24/7 of their lives. And then we talk data security and regulation, and you see everybody needs to reconsider in this.
Great insights, Thomas. Thank you so much for having you here and for having me here, for the invitation, and looking forward to learn more in the future of healthcare. Thanks.
Super. Thanks very much.